Hi, I'm Bobby Peer with TAPinto, and I'm here with Dr. Anthony Terrana. Welcome, Dr. Terrana.
Hey, Bobby. How's everything today?
Everything's great. I also want to say that you're with Terrana Orthodontics.
Yes, yes,
So that will lead me into what I would love to talk about is Invisalign. It's not
yes.
only for adults anymore.
It
And
is not only for adults, for teens as well, children of all
so
ages.
what when would you recommend a teen to use
Mhm.
Invisalign versus the traditional braces, or is
So,
that by choice?
yeah, no, it's actually a great question. So now Invisalign has become so advanced with their attachments and their smart track material that Invisalign can now treat exactly the same cases that we were only able to treat with braces. So all those complex cases, rubber band wear, overbites, overjets, are all able to be treated with Invisalign to the same level that we were treating with braces. So now we're seeing a lot more teens wanting to go into Invisalign versus braces because a lot of them are going into high school. They don't want to wear braces into high school. There's a lot of advantages to the Invisalign teen. You could take the Invisalign out. Teens are able to brush their teeth, floss their teeth, keep their teeth a lot more healthy than they were able to do with braces. There's also less emergencies involved. You don't have those poking wires, those broken brackets. Doesn't ruin family vacations when the child has a poking wire, a broken bracket, and they're stuck on vacation and they're in pain. And nowadays everyone has such a busy lifestyle. They don't have time to come to the orthodontist to fix a broken bracket or clip a poking wire. So it's reduced the amount of office visits to the orthodontist by having Invisalign Teen.
Okay. Now, is there an age that you would say is more appropriate? Because there is
Mhm.
probably a little bit of fear from a parent's perspective. You
Yes,
can
yes,
take them out. So if
yes.
they're too young, maybe they might lose.
So we ideally don't start comprehensive orthodontic treatment until the child has all their baby teeth out and their permanent teeth in. So unless there's a reason to go in early for a phase one treatment, that usually involves orthopedics with expanders and not necessarily braces. So when we are ready for full braces at that age, they're usually ready as well for Invisalign. So what we
Okay.
tell parents all the time, if they're concerned about their kid losing the aligners, you just jump to the next aligner. So Invisalign prints extra aligners, and you could wear each aligner for a week and always jump to the next week if you end up losing an aligner. To be quite honest, I have teens in Invisalign, I have adults in Invisalign. My teens handle Invisalign almost better than my adults when it comes to
Funny.
responsibility. Right.
Okay.
So I have not seen any sort of non-compliance amongst that age group with the Invisalign. They actually make little compliance indicators on the aligners so the parents can check and make sure the teens are wearing it enough. There's apps on their phones to make sure they're wearing it enough. And there's
Wow.
also an Invisalign teen guarantee where if they're not wearing it in the first 12 months, Invisalign will actually pay for them to switch into braces to guarantee that they will, be compliant and they're not going to kind of waste their money on Invisalign. So
Wow.
it's a great program that Invisalign has created for the teens.
They covered every basis.
They thought of everything. Yeah, yeah. And we're seeing
Wow.
great success. The teens love it because they could go to school. They don't have to worry about having metal braces and, all the aesthetics and
So what
all
is
that.
the process? How is it different than the traditional braces?
So it's a very similar process. They would come in for a consultation. We would go over treatment, present them both treatment options. Then we usually take a 3D scan with our iTero machine, get sent out to Invisalign. I work on a prescription, so I move the teeth in 3D. We place attachments on the teeth. Then the team comes in their first visit. They get attachments on their teeth. The aligners, we go over all the instructions, how to wear them, how to take care of them, what to do if you lose one. And from there, they're on their way. And the other great thing we like about Invisalign Teen is we're only seeing patients every 2 to 3 months versus monthly with braces. So it's a lot less trips to the orthodontists, especially nowadays with busy families and kids in so many extracurricular activities. It's a lot easier to be treated with Invisalign because you don't have to come to the office as much.
Okay. So what is it, a lesser period of time that you're in Invisalign versus
We
braces?
are seeing about a 30% increase in a decrease in treatment time with the Invisalign. The
Okay.
great thing about Invisalign is since we are prescribing tooth by tooth on the computer, we're getting the tooth to go directly from point A to point B versus once braces are on, the teeth all kind of move, then we kind of bring them back together and it's not as direct as we are doing with braces.
Such modern technology.
Yeah, it's amazing.
So I'm going to ask a basic question, but so when you're done with Invisalign and your teeth are
Mhm.
perfect, you have a perfect
Yes.
smile, what do you do after to continue the retainers? Are there still retainers?
Yes, there's still retainers involved. So there's no research or anything to indicate that braces versus Invisalign won't cause relapse later on. So whether you are treated with braces, whether you're treated with Invisalign, your teeth are always going to have a constant force on them throughout life, which could move them. So that's why whether you get treated with Invisalign or braces, it's very important to wear a retainer. We usually say wear that retainer nighttime for a lifetime because your teeth always want to move back to their original position. So it's really important, whether it's Invisalign or braces, to wear a retainer when you're done so those teeth don't move.
Okay. And my last question is, I know insurance policies pick up the cost of braces
Yes.
or partial. I don't want to say that it's,
Yeah. Oh, yeah. Yes.
but is it the same with Invisalign?
Yes. So insurance does cover Invisalign as well. So if someone has a $2,000 lifetime max, whether it's used for Invisalign or braces, it can be used for either. That's actually a great question that a lot of parents have. We are in network with most PPO insurances. So their insurance coverage, at the end of the day, will cover braces and Invisalign equally. So it's the same price, which makes most parents feel like it's a no-brainer to kind of go with the Invisalign route. So it leads to
No,
less office visits, less emergencies, and more patient comfort.
this is great information. Thank
Yeah.
you, Dr. Terrana.
You're very welcome, Bobby. It was great seeing you today.
Great seeing you too. Have a good
All right.
one.
Take care.